the recording. Okay, now I did. Um, Sorry. So my name is Katie Season. I use she, her pronouns. And I guess we'll just get started in kind of explaining who I am and how I came to this work. Um, so I am a trained midwife and a former NICU nurse. I worked in the neonatal intensive care unit at SUNY Downstate Medical Center from 2014 to 2019. SUNY Downstate Medical Center is a segregated Black hospital in central Brooklyn where over 90% of our patients were Black. So I first learned about racial health disparities in infant maternal health outcomes during a lecture during midwifery school, actually, while I was working in this neonatal intensive care unit. And when I heard that Black babies were 3 times more likely to die than their white counterparts before their first birthday in New York City, I immediately knew that not only was this like, well, obviously this is super problematic, but I knew that I was somehow involved in that problem because I was a NICU nurse at a hospital that only took care of Black babies. And babies are more likely to die in a neonatal intensive care unit than any other environment. If Black babies were 3 times more likely to die, I just figured, like, what are we doing wrong at this hospital that is putting our patients at such a higher risk to not survive before their first birthday? And so, kind of, in short, what I learned is that there's an incredible amount of structural racism in how New York finances health services, and that those multiple layers of structural racism are going to kind of show up most clearly at the Blackest hospital in the state. And that we were an incredibly dangerous hospital that was missing multiple specialties and services, ostensibly, or like not ostensibly, because we did not have the money to pay for appropriate staff and services for our patients because the state didn't give us enough money to didn't get enough money to meet those basic needs of the patients who come through our door. And so that got me started on my activism organizing journey. And so I tried to do pretty much everything I could think of to do as an employee to advocate for improved patient care conditions while I was working at the hospital. And when it was clear that those weren't going to really have any meaningful change, I resigned from my position to work on advocacy full time. And which is when I started my social media handle at Brooklyn Grows, and then shortly thereafter started the campaign Equity for Downstate, which was a campaign to focus to reduce racial health disparities by eliminating disparity or racial disparities in health financing. So I learned a lot through doing that campaign. One of the main, or one of the 3 layers of structural racism in New York State health financing is that SUNY Downstate was one of 3 SUNY hospitals, and the other 2 SUNY hospitals that are predominantly white serving were both receiving $50 million a year in the state budget. And for no reason besides what I was told by insiders that Cuomo doesn't like Downstate, SUNY Downstate, which is a 90% Black serving hospital, was not receiving that same $50 million in funding. So one of the main purposes for Equity for Downstate was to get that missing $50 million and to achieve funding parity in the state budget. And we were successful in doing that. Woohoo! So in the 2020 budget that came out this year, the line that had previously always been missing of this funding for Downstate mysteriously showed up, and it's not mysterious. It's because a lot of folks, many who were on this Zoom, were helping me make appointments with their state senators and with their state assembly people. We were presenting this evidence and this research to those state senators and asking them, can you call Cuomo and ask him what's going on and why we're not getting equal funding? And also, can you promise us that you won't sign on to a budget in the future that has this funding disparity? And so kind of without us needing to get a lot of signatures on a pledge form, this funding showed up. And so and so, sorry if please feel free to unmute yourself if you have a question. And also, if I hear somebody who sounds like maybe it's accidentally unmuted, I'll just mute it. But if that was a mistake, unmute yourself and please feel free to ask any questions. And so right now, Equity for Downstate as a campaign that's like focused on things about and around SUNY Downstate is kind of on hold because there have been a handful of students that have been super hardcore in supporting me and the work. And we need more than just students, current students at Downstate, pushing that forward. We really need our alumni. We need the more doctors who work in New York City were trained at SUNY Downstate than any other medical school. So we need those doctors to start coming to Zooms like this, to start tuning into the issues that was happening at the hospital where they trained, and to work together to support the Equity for Downstate campaign so we can continue to address the state perpetuated medical racism that is happening at that hospital. But kind of in doing Equity for Downstate, and I learned a lot through doing that campaign. The $50 million was one part, and then the other part of eliminating racial disparities in health financing is really by eliminating our current system of private-public health financing, because private and public insurance is separate and unequal insurance that essentially guarantees separate and unequal results. In New York, 2/3 of Black birthing people are on Medicaid, whereas 2/3 of white birthing people are on private insurance. And private insurance pays twice as much for obstetric care than what Medicaid does. So essentially, the government is saying these lives are worth half as much. It is worth half as much for this population of people to bring new life into this world and to reproduce. And we've done lots of tinkering in the past of trying to improve our separate and unequal system of health insurance. And it hasn't, and disparities have only gotten worse in our country. So the other portion of Equity for Downstate, and essentially what I've been focusing a lot of my time and attention on now, is the New York Health Act, which is a New York's law, state level bill for improved Medicare for all at the state level. So it would provide universal guaranteed health insurance to every New Yorker, regardless of immigration status. So some important things to know and understand about the New York Health Act is that we have been really close to being able to pass the New York Health Act for the last 2 years. So we have 63 senators in the New York State Senate, and for the past 2 years, 31 of them were co-sponsors of this bill, which means we were only one co-sponsor short of being able to pass universal guaranteed health insurance for all New Yorkers. Guys, think about if we had passed this at the beginning of the session in 2019, two years ago, it would be starting to implement now. And in the midst of this coronavirus pandemic where everybody's losing their job and wondering what they're going to do next, we would have essentially no worries, we have a universal system that we're already transitioning to. Unfortunately, we didn't do it back then, but this new legislative session offers us a new opportunity to get the missing support that we need to pass the New York Health Act. This graphic shows the 9 Democratic state senators who sorry, one second. The 9 Democratic state senators who are not yet in support of the New York Health Act. One of them actually lost their seat, Monica Martinez. And so essentially what happened in the elections in November is a complete wash. So we picked up some seats of senators who are firmly in support of the New York Health Act. We put up as many seats of people who are firmly in support of the New York Health Act as we lost seats of people who were firmly in support of the New York Health Act. And so what the situation looks like across the state right now.
How are you?
Is if you see in sorry if someone's unmuted, if you would.
I know. I'm sorry. It sucks that she's got homework. Like, she has homework at all.
Sorry, I'm just gonna. Okay, got it. So, looking at these maps, you'll see in New York City, the green shows sponsors who are firmly in support of the New York Health Act, and this blue should be green. The yellow shows districts that are held by Democrats, but who are not yet in support of the New York Health Act, and the red or pink are Republican-held districts. So the and so here is what you can see is that the New York Health Act has a lot of support here in New York City and much less support out in Long Island and in upstate New York. So upstate New York is by geographically predominantly Republican and about split between of the democratically held districts between people who do and who do not yet support the New York Health Act. So essentially, one of the main lessons I learned in doing the campaign Equity for Downstate is that more than any one campaign is we really need a movement of people who are working together and in coalition to advance reproductive justice agendas throughout New York. So New York has the money and the political environment that we need for transformative change. We really just need a movement. And so what I mean by that is if we look right now in our state legislature, we have a veto-proof majority in both the state Senate and the state assembly. So even if we pass something that Governor Cuomo doesn't agree with, we can get it passed and keep it passed because we have enough support in both houses if there is pressure on those legislators to move in that direction or another. And then the other thing I think is super important to realize is that New York on its own is the 12th largest economy in the world. So there's been a lot of talk of people in our government essentially saying like, well, we can't do X, Y, Z because we haven't gotten the money from the federal government yet. Where do you think the federal government gets most of its money from? Really rich people who live in New York City. So we don't need the federal government to tax rich people to fund programs to help New Yorkers. Certainly we should be pushing for that to help our neighbors and friends in other states, but for our neighbors and friends in New York, we need not throw our hands in the air and say the federal government is a dumpster fire. We're not going to get any of the relief that we need. We have the power to levy taxes at the state level, and we have a huge portion of the rich people in the country living in our state who we are able to garner taxes from. So there really isn't like think of the most expensive progressive program that we could implement to improve the lives of birthing people. So think, for example, what if we sent every birthing person a check for $4,000 starting from their third trimester on? And so if they want to work, great, and now they have a great budget to pay childcare, the person who's going to help them with childcare, an equitable wage. And if they don't want to go back to work, great, because they're getting $4,000 a month from the government and it's a livable wage, and you can spend the next 2 years like actually parenting your child, mothering your child, and chest feeding, breastfeeding, parenting the child the way that you want to, which is like more or less the definition of reproductive justice, to be able to raise them in a healthy and safe environment. We could pass a law like that, and we could fund it from the money that is in the state if we are working together to be able to do that. So the idea behind the Movement to Birth Liberation is folks who are organized by legislative districts to advance birth justice and reproductive justice issues here in New York City. So we can do it at City Hall, so we can do it at the state level in Albany, and so that we can do it in DC on the federal level. So if we look at these maps of like where the New York Health Act does not yet have support, there are birthing people in every one of these districts who are struggling with their insurance companies, and who insurance companies are putting up extra barriers for them to be able to receive the type of pregnancy care that they would like to be able to receive. So if we can, as birth workers, as birth workers, as birthing people, and as folks who are networked along those lines, can connect with folks in all of those districts and be organized and worked in coalition, there's really nothing that can stop us. And then furthermore, like as we are organizing within our legislative districts to put pressure on our representatives to support the legislation that we need to advance our to support the legislation that currently exists that will benefit reproductive justice and birth justice issues, we can use what we're learning to make our own laws. So something that Sava Rose and Mila are going to mention, something the three of us have all had in an experience all of us have had in common, is we've spoken with legislators who are very concerned about the issues we bring up with them, and then as we're finishing up explaining what the issue is, they ask us, okay, do you have a piece of legislation we could sign on to that would fix that problem? And my response certainly back in 2018 was like, I'm sorry, do I have legislation? I'm the nurse, you're the legislator. Like, isn't it your job to write the legislation and I just like give you the information? Well, I mean, what happens at the federal government is different, and I have less insight into that. But at the state government level, most state legislators have 4 to 7 people on their staff, which is about enough, as many people as can answer the phones and keep up with a schedule, and like handle constituent complaints. It is not enough to have like a couple of people who are dedicated in really researching issues that affect constituents and translating that research into legislation. So if we want really radical, really amazing reproductive justice legislation that adequately addresses the needs of our community, it really has to be us that writes that legislation. And so as kind of the idea for the movement is, as we are organizing by legislative districts around these issues that already exist, we learn the tools that we need, and we kind of see how Albany works so that we are able to write our own legislation. And then when we have that legislation written, we are well placed and well placed and in good coalitions with our neighbors to get that legislation passed quickly because of all of the prior organization work we've done on things like the New York Health Act. So I want to pause here because someone who's been involved in the movement for a while, who's Charlie, has been helping with, or something the movement has been doing since before we had an Instagram account, when it's just like various RJ minded people, was putting together recommendations to actually improve the New York Health Act for birthing people. So I'm gonna throw to Charlie to just kind of update us on that process and how it's going.
Hi, everyone. Thank you, Katie. My name is Charlie. I use they, them pronouns. I am a full spectrum doula in Brooklyn, based here in Crown Heights, and have been working with Katie on these issues for a couple of years now. So I've been kind of involved in the in our most recent efforts to help push forward the New York Health Act, and just want to give this little update about some recommendations that we came up with that would support, better support birthing people who would be covered under the new insurance program. We had a meeting recently with Assembly Member Gottfried, who is the original author of the bill and someone who has been, a big supporter of having more community input and really making sure that the bill is helping New Yorkers in the way that it's intended to. We brought forward some recommendations to that meeting that we came up with. And when I say we, I mean it was a group of birth workers, some doulas, midwives, folks who have been following along with this work and who wanted to give their input and also bring back some input from their respective organizations. This has been like a very open process for anyone to sort of contribute and help put in their input, and we're looking for more of that. If folks are interested, you can follow up with me or Katie, let us know. But some of the recommendations that we had come up with, let's see, there's quite a few, so I'm going to try and get through them quickly. The first one was that the bill, as it is written, provides coverage for prescription and non-prescription drugs and non-prescription smoking cessation products or devices. And we were sort of recommending that the bill be adapted to also include contraception devices and products, as well as like over-the-counter products and devices that support fertility awareness and management, first aid supplies, and anything that's any kind of like menstruation products. That's obviously something that, we could just continue going on and on adding things in there. And so that's sort of like more of a conversation around how much can we kind of like slip in there before they put a cap on that. But there are like several programs that already exist in New York, like the one of them is like the New York Condoms program, like statewide program that helps supply free condoms to clinics and like all over New York City. You can find them. So we're looking at things that have already been essentially set up to kind of like set a precedent for like how we can provide those free products to people through the New York Health Act. There's also, so another recommendation was that on the bill, as it's written, it establishes a board of trustees and several regional advisory councils. And those would be made up of representatives appointed. The board of trustees is appointed by the governor and represents professionals who are working in different healthcare fields or for healthcare organizations. it established a membership of 32 representatives. And we were wanting to add trustees to that board that would represent specifically midwives and also organizations that represent the interests of nurses. To the regional advisory councils, we also ask that there be a seat for folks who either work in transgender healthcare services or work for organizations representing trans folks. And we also ask that, anywhere in the bill that it's essentially making like a stipulation that when there are changes to the program, when they are developing standards for how things get approved, that the commissioner approving those changes needs to seek like recommendations from organizations and healthcare providers who are actually providing those services to the community. And so in the bill, there's like a long list that basically gives a list of people who have to be, whose advice needs to be sought in order to implement changes or develop standards for how healthcare providers are either approved in the program, meaning like if one is a home birth midwife and wants to be reimbursed by the New York Health Act or by the New York Health for providing midwifery care, then there is essentially there are some standards for how one can get approved as a provider in order to get reimbursement. Same with any like clinics, hospitals, anywhere that services are accessed. And a recommendation that we had was that birth centers be specifically named and acknowledged as like one of those entities that must be consulted in order to develop those standards. Previously, birth centers were not mentioned anywhere in the bill, and we wanted to really get them in there as much as possible to make clear that they have different and unique interests than like hospitals providing labor and delivery care. And let's see what else. There's a part of the bill that essentially says that if anyone in New York who qualifies for federal who qualifies for Medicare and would get like federal funds to reimburse their medical costs, that they must submit documentation essentially like proving that they qualify and are eligible for those funds. That way the New York Health program isn't having to cover that as well in addition, and there's not like double coverage happening. The bill essentially writes that if that paperwork, if the necessary documentation isn't provided within 60 days, that those individuals could be dropped from the program. And we recommended that, this is not like meant to be a punitive thing. If that documentation is provided and someone can prove that they are eligible for Medicare, that they should have their coverage under the New York Health Act reinstated within that time, and anything previously, any services that they had accessed before then should be reimbursed. Okay, I think that's it as far as like the recommendations that we were able to provide to Gottfried in our initial meeting. He was very receptive of all of those changes, and he encouraged us to seek out a meeting with Senator Rivera as well, who is one of the co-sponsors in the Senate. And so we have a meeting planned this week that will be on Thursday, I believe at 4:30, right, Katie?
They just emailed us to move it to 4.
Oh, shoot. Okay, so Thursday this week at 4 p.m., we're going to have that meeting with Rivera, Senator Rivera, and it is very helpful to have, sorry, sirens outside my window. It is very helpful to have, people like virtually with us on that call to show that there's lots of constituent support and that this is an open and democratic process as far as like gathering recommendations for folks who actually work with birthing people in New York. And so if anyone wants to join that call or would like to speak to any of the specific recommendations that I mentioned and why they feel that those are important to be included in a new draft of the bill before it goes to the Senate floor for a vote, then we would love to have you. I think that's it. I don't want to take up too much time, but yeah, okay, good. Thank you so much for listening to this spiel, and I hope I'll see you on Thursday.
Thank you so much, Charlie. I think definitely would love to have, if you are free Thursday at 4 and you want to come to support, that is awesome. If you have not been a part of the working group process up until this point, I probably won't have time to connect with you before Thursday about a speaking role at that meeting, but please come to see what it's like. And then definitely going forward, if there's a recommendation that we missed, anything like that, we can, keep working together as time goes forward. The hope is to get these recommendations in to the New York Health Act, to the version that is introduced this year, so that if, fingers crossed, we are able to get that last co-sponsor, that last support, and it gets passed, all of these recommendations are in from the get-go. Probably at this point, if you are realizing there's something we missed, we'll have other ways to work on getting those recommendations in. So please stay tuned and get involved, and through relationships, we'll figure that all out. So I guess referring to, Charlie talked briefly about the process of coming up with these recommendations, but in October and November, we had a series of teach-ins, which led to a series of working groups, and that's kind of how we came up with the finalized version. So if you missed those teach-ins, please go back, and they are on my YouTube channel. I speak much more at length about kind of my journey into health justice activism. And so if you're like, still, who is this girl and why is she doing this? There'll be I answer a lot more of that there. So yeah. So lastly, how did this Zoom come together tonight? I've been trying to get on legislators' radars for the past couple of years to deal with issues at the state-run hospital where I was working, and where there was clearly a lot of medical racism going on. And kind of as I was doing that, my friends were like, oh, there's this girl, Mila, and she's working on some legislative issues around birth centers. You guys should connect. And so we connected last summer, and we've been working together, putting our heads together on birth center stuff. And it's kind of been, oh, you guys are doing these things, you should meet. And so Mila, Bronx Rebirth, and Save a Rose, we have all been kind of crisscrossing paths in working with legislators and working on these issues. And so we thought, let's team up and have a space where we can kind of share everything that's going on with folks who are interested in this. And so that's kind of how this ended up together. If you are working on a reproductive justice issue that you would like to be a part of a future Movement Monday, I think the intention will be we'll probably have teach-ins and other things going on other Mondays of the month, but to make the first Monday of the month like a general, like the big one, like the General Assembly, where we do all of the announcements. So if you can only make one, try and make it the first Monday of the month. So, and if you are a group like that would want to be involved in future Movement Mondays, please just reach out and let's get to know each other and do it. But with that, Mila, let me pass off to you. And so I'm going to stop my screen share because I know you had things to share. Oh no. Mila, are you able to share your screen or do I need to give you host access? Oh, Mila, you're muted. Sorry.
Okay. Hi. I couldn't even find my face to unmute. There's so many faces here and names. Awesome. Hello, everybody. My name is Mila. I've been a birth worker for almost 15 years in this tri-state area, and part of what I've done already, in addition to starting a private practice as a birth doula, is I supported in opening a birth center in Uganda many years back in 2008, 9, and kind of officially came to being acknowledged in 2011, and then worked on co-founding Uptown Village Cooperative, a multicultural group of perinatal professionals who are focusing on Upper Manhattan and the Bronx, and just positioned mostly as educators, but also lots of the range of maternal health professionals, and now working to open the birthing place in the Bronx. And I'm very thankful for the positive energy out there, constantly aware of it, and nonstop appreciative of it. So yeah, Katie and I've been following her work for years before we officially connected on just this advocacy tip, and this particular advocacy tip. And part of what I think might be useful today is, it may be very obvious to many of you, many of us who are birth workers, but I think a nice entry point is to really understand the benefits of midwifery-led birth centers, and then maybe from there on a future Movement Monday, get into some nitty-gritties about like how we've been taking things forward specifically, and maybe, you know, depending on timing, because I also know that I have a allotted amount of time, so like depending on timing, I can also give a little clue into like what movements have been happening as of late. So let's see. I'm going to share screen. Host disabled participant screen sharing. Maybe that'll change. Let's see. Oh, awesome. Someone made a comment about wanting to open a birth center in Bolivia. Oh my gosh, like that sounds awesome. Like what I was intrigued about the process in doing something, and Katie, just give me a nod when I should try to screen share again. Oh, okay. I'll just finish that thought is sometimes in other countries, you can just go for it and say, okay, who are the people who've been doing this work generationally? Where are you at? Show up, let's talk. And then you just make plans and then you do it. And then you say to the government afterwards, like, yo, we've been doing this thing, like, and look how effective it is, like, pay attention. And they're like, oh my God, awesome. You guys are awesome. Let's now acknowledge you. So it's like, it's the other way around sometimes, but here when I first got exposed to like the path of what it would take to open a birth center in New York, I was like, oh my gosh, and we'll definitely talk about that. But for now, I'm going to screen share and open up this page. Okay, can you guys see the screen? Okay, sweet. So these are pieces of wonderful tools and research and information that I've gathered from American Association of Birth Centers, which I've been a member of for now, I don't know, I don't know, forget time, but basically they're a really great resource, and I've learned about birth centers across the United States, so I'll just go ahead and dive in. Present. There we go. All right. So, yeah, birth centers, these are the topics that I'm gonna touch on. So first of all, what is a birth center? A birth center is a healthcare facility where childbirth is addressed through the midwifery wellness model. And so midwives are the key providers in a birth center setting. And sorry, the faces are like covering the, okay, here we go. Did I accidentally move forward? No, I moved backwards. Okay, great. Okay, so it's integrated with the healthcare system and guided by prevention, sensitivity, safety, and appropriate medical intervention and cost effectiveness. So birthing people who are giving birth in the birth center setting should be already low risk, and they are cared for in a whole approach. And that may be paying attention to the psychosocial aspect of their cultural exposures and what nutrition they might need to focus on to get them you know, continuing in a healthy pathway towards healthy birth. And so things are addressed nice and early on, and that's what it means here when we say prevention and sensitivity. So physiologic birth, if that is essentially birth that is in harmony with the physiological processes of the human birthing body and just left to do what it does, which is knowing how to birth. And you know, it's basically supported, and that's the central that's the angle that midwives are supporting in this setting. And it is while this can happen in a hospital setting, physiological birth that is, it is not the exclusive model of care and the constant approach, right? So birth centers respect a birthing person's right to make informed choices about their healthcare and their baby's healthcare, and essentially they are participating in their care and making decisions with their care provider in a way that is quite collaborative. Here you can see that since '84, when there were 124 birth centers across the US, there has been a constant increase, and in 2020, there are 384. And just in the past decade, we've grown a ton. And of these 384, there are only 10 or less that are owned or led by people of color. So that's another just point to make, that in order to really fully be able to reflect the communities that we serve, we have to have more representation in the field. So yeah, let's see. Yeah, this is basically, yeah, just another more elaboration on that graph there. 200% increase in the past 10 years. Meanwhile, as you may know, New York has 0 midwifery-led freestanding birth centers, and that's really concerning. So community births include home births and birth center births, and you know, has also increased. The interest has increased, and meanwhile, New York has 0 midwifery-led freestanding birth centers. So some things, again, may be obvious to many of us, but I think it's just important to note that birth centers statistically have lower cesarean rates, improved outcomes, cost savings, and more client satisfaction. And these are studies that have been done through the decades. Oops. US ranks worst in all developed countries, and spends more, yet leaves our families with greater risks of dying. And we in the US rank 55th in maternal mortality. And this is like talking about all the nations of the world. And 33rd in infant mortality. And then when we bring it back to New York, once again, New York being the 12th highest in cesareans in all of this nation, and New York City having significantly worse statistics, and the Bronx having within the boroughs even worse statistics. So this is also why we want to address access to birth center care, first of all, and then midwifery-led birth center care at that. And then, you know, just if we really want to just dig in here, like why should we not have this option available to us? You know, there's a lot of millions of people in this state, not just our city and our boroughs, but in this state, there are a lot of birthing people who do not have access to birth center care. And I'm going to address now this triple aim here. The triple aim of what is this? This is the Center for Medicaid Services, Medicare and Medicaid Services, that we should be able to address these three things. And these three things are improving health for like the overall populations, right? Then we have better care individually for birthing people, and then also lowering costs overall. When we think about the costs that are spent in settings where there are tons of interventions versus when there is minimal to none. So these are the birth center model and approach addresses all of these things. And here are just some specifics. Again, significant decreases in cesarean birth, preterm birth, low birth weight. And then we have the good stuff, like people reporting that they had comprehensive care, that the environment was relaxed, that they had that, you know, collaborative decision-making model, and that things were patient-centered. Stuff we want, right? Yeah, there's a lot of, this is just more numbers on how costly unnecessary interventions cost our state. And also this number here, 42.3% of births were covered by Medicaid in 2018. That's nearly half. And so when we think about our costs to the government, and then we think about all the costs for all the unnecessary stuff that goes down in the hospital setting, obviously that some of those things are necessary, but there are a whole lot more that are unnecessary. And that definitely takes up a lot of our dollars, which we could be spending elsewhere. Okay, so this is just showing what, I hate that the faces are blocking. Okay, so anyway, this is just showing the different states and how many licensed birth centers are in each state. We have 3 in New York, 2 of which are accessible to the 5 boroughs, and 1 is in upstate in Rochester. They're all physician-led, okay? So it takes, and they've been able to open with, you know, the ability to just have the resources financially to overcome some of those barriers that exist, that still exist, despite, okay, sorry, subject for soon. So let's see. Yeah, I'm gonna skip this one, okay? Yeah, So, oh, here's a good one. So, so under Medicaid Reimbursement Act, freestanding birth centers have been part of the Affordable Care Act, and with the intention of saving healthcare dollars. And freestanding birth centers are defined as what we are working to create more of here. And in this federal act, it states that midwives should be covered and reimbursed, and same with facilities should be reimbursed by Medicaid. And it mandates this. Meanwhile, on the federal level, it's been integrated into law, but New York State is a barrier for us having access to what the federal law has actually said. Hey, we want this to, be available to people to save dollars, and all the, triple aim that I discussed moments ago. So we're behind. Yeah, and here we have, Strong Start is a model of care. They did studies on it in many of the birth centers throughout the US. And, basically it's just enhanced care where people have care from their peers, and they have group prenatals. There are wonderful approaches that we would want to incorporate into our birth centers here in New York eventually. And so it's, and I just have to give a nod to connecting with other birth centers throughout the state and seeing their approaches on how they do these group prenatals, and the timing of when people have shared ones versus private ones, and just again, ways to be cost effective, but also really awesome. And yeah, so as we may know of the care from being birth workers or having folks who have been cared for in this subpar system, is that our birthing people are exposed to just an over medical focus, and a lot of interventions are suggested when they might not be necessary, and there is not enough education on even nutrition. I had an OB as a client recently, and she was like, oh, okay, I gotta ask you something. What should I be eating? And I was like, wow, okay, let's talk about what books you can read that are going to really get you set up for, a good remainder of your pregnancy. And so, admittedly, she had no idea about what kind of foods could support her pregnancy really positively. And so, and she's dealing with how many people, and she can't answer that question really honestly for them. So anyway, all this to say that there's not enough education to be on that preventative tip again, right? Even preconception education, right? These are the kind of things that we should be exposed to in community. And so there's lack of continuity of care also. And so these are things that sorry, yes?
Oh, finish your sentence.
Okay.
Oh, sorry.
These are things that are common in what is weaknesses in our system.
I'm sorry to throw you off, Mila. Some people are putting in the chat that they need to head out, so I wanted to make sure we get some of the action steps out for the birthing place before folks who needed to leave at 8 sign out. So could you just, this information is super helpful, and I think we're going to be aiming to set up a teach-in that's just on birth centers, so we can get into all of these slides in a deep way and ask questions on them. Okay. But for Mila, can you update us briefly, where are we now? Kind of what are the two fronts we are trying to push increased access to birth centers on, and how can folks help?
Okay, great, great. So this is also, and I guess something we could have talked about a little more of, but essentially I will save this and hop into my little notes here. I'm gonna, can you unscreen share? Oh, I need to do that, don't I? Stop share. Okay, great. Thank you. Okie dokie. Are we still, am I still here?
Mhm.
Okay, great. I don't see anything right now. Okay. Okay. Basically, one of the things that we're hoping is that people will participate by signing our petition. And if you haven't already signed that petition, to please do and not only sign it, but to share it. So the petition was evolved from a letter to our governor and maternity task force, because we essentially received a public promise for having access to out of hospital, more safe birthing sites that are out of hospital. And so one of the things that we wanted to address there is the fact that this has been a public commitment, but no action has been taken. And so we want to basically really keep spreading that word that it exists. And we want to create a public campaign to help people understand, you know, essentially like what midwifery-led birth centers are, as well as the benefits that it can have for our community, and also in advance of more conversations happening around this, that we really want to debunk the nonsense, because there's a hostile environment when it comes to midwifery. There is a hostile environment when it comes to creating access. And if you don't know what the certificate of need process is, it essentially is may have had good intentions and, you know, good reason to exist in different times in history, but what it has created now and what it is, how it has posed barriers for us, is that smaller businesses need to seek permission from the existing ones to be existent, essentially. In order to exist, we need to prove that we're needed. And hospitals can easily argue that, oh, we already serve birthing people. And if you're pulling up in my neighborhood thinking you're going to, you know, take away some of our business, then, you know, we're going to say we already serve that need. So therefore, no. Right. And so this has existed throughout many states, and many states have worked to overcome it. And so we are following in the footsteps of working to overcome it. And it's not that we want to eliminate certificate of need. We actually say, go ahead, exist, but here are why midwifery-led birth centers are different. Right? And the reason why we're different is because you don't serve this particular need. We're serving something totally different. And we're not opening a small hospital. We're opening a small, more like a than it is a small hospital. And we're dealing with low risk mobile people, where, you know, some of the existing barriers from even just the from the standpoint of the Department of Health and the requirements that they have on the construction are taking into account, are approaching the angle as if we are opening a small hospital, and, you know, dealing with people who are unconscious, and like we'd need a sprinkler system to help in case there was a fire, but like not cognizant of like if there was a fire, people could walk, you know, out of the doors. And, you know, same with the just the structure of the building itself, the height of the ceilings, width of the hallways, size of elevators. So what we're doing is we're communicating with our legislators, and we have been wanting to improve this process and point out how it what barriers, what ways it can be improved. And so we're collaborating with the Commission of Accreditation of Birth Centers, and basically, you know, when Katie mentioned earlier about people who were talking to, you know, state senators, assembly members who are asking us for legislation and like examples of different states that have done it well, we are working with these other entities like the Commission for Accrediting Birth Centers to help basically point them in the right direction. And we have a few examples that we've provided. Sorry, go ahead, Katie.
Yeah, thank you so much for sharing, Mila. I just want to, I think if you are thinking, no, don't interrupt Mila because I want to learn more about birth centers, awesome. Sometime this month or next, we will have a teach-in that is just birth centers to get into these issues super deep. Right now, if there is an executive order that if Cuomo signed would remove a lot of the barriers and immediately and let a lot of birth centers open immediately, and he is not signing it because the word from his office is they don't think there is the political appetite or like the political demand for him to take a risk to sign it. So how do we change that perception is we create the demand to Cuomo's office and show, no, there are a lot of us out here that need it and want it to get signed. And the best way we can do that right now is by gathering signatures on that petition. And then the legislative route is, you know, I have also tune in for a future teach-in on how Cuomo is a white supremacist, because one of the reasons that health disparities are as bad as they are right now is because Cuomo has been the governor for the past 10 years and has made multiple intentional decisions to disadvantage Black and brown New Yorkers in their access to health facilities in ways that have had deadly consequences. So there's really, I'm not holding my breath for Cuomo to come through for us. I think the best way is using the legislative means. Folks who have been paying attention to reproductive justice midwifery related legislation are telling us, oh, but if we do the legislative way, that could take years to get it passed. And the reason why they say that is because usually it takes years to get a midwifery bill passed because it's the 5 to 10 people on that committee that are doing all of the work to try and get in touch with legislators to communicate about what that bill is and why it's important. So hopefully what we grow as the movement to birth liberation is a community of people where Mila does not need to make 63 different meetings to explain to 63 senators what the benefits of birth centers are, because 20 or so people have come out to the teach-ins and understand it pretty well themselves and are able to work with the groups of reproductive justice advocates who they've already gotten to know through working on the New York Health Act and other initiatives to set those meetings, to speak with their legislators and to get them on board. Another thing that we've been told in meeting with, or Mila, correct me if I'm wrong, but essentially Assemblymember Gottfried told us essentially the stronger we make this bill in getting it what you want, the harder it will be to pass. Which is to say, like, the more it works for us, the more it disrupts the existing power structures. So the more opposition we may face. Well, again, there may be like a crotchety OB or hospital administrator in a handful of these districts that's willing to call their senator and complain. But hopefully there are hundreds of birthing people in each of these districts that would benefit and want to have a birthing center. And so hopefully what we are able to do as a community is to get everybody who will benefit from having a birth center to understand what those barriers are and be able to communicate directly directly to their legislators, so that when Mila and the other group of amazing advocates who've been doing the super nitty gritty work to get the bill to say the exact right thing, that we can actually get it passed and get it passed quickly, because we have a community of people that are ready and trained and eager to do things like that. So Mila, thank you so much for sharing. Was there any other things that I missed that you want to make sure we get into?
No, it's basically the three approaches, and it's, you know, the petition straight to the governor, the legislation journey, and getting everything like on point with the language, and then having everybody have that awareness campaign and really pressing it to their leaders. And that also includes the third approach, which is that grassroots, like from the people side of things. And so this bill is almost what we need it to be, and hopefully will and they've been very responsive with like it's being released as it was, but there's just a couple things that we need to change, and they're just willing and open to hearing exactly how it can be changed.
So just to summarize, don't call your person today or in the next week or two to ask them to pass the birth center bill, because we're not ready yet. Call them to tell them to tax the rich and other things, and then hold up, and when we're ready to go, we will let you know, and we'll have a huge push to try and get people to calling their legislators. But stay tuned on
Katie,
that.
But
yes. Bronx Rebirth, I was wondering if one of you wanted to go next to just do a quick intro update. How can we be supporting you?
Sure. Thanks, Katie. Hey, everyone. Evelyn has also joined us, so I want to give her the opportunity to say hi as well, since I introduced myself a little earlier. I think she's still on the line. Well, I did mention that BX Rebirth has been around not for too long. We started in 2020 in direct response to what we were seeing in our communities in the Bronx, where people were needing basic material resources, and those were diapers, wipes, and formula. So Carmen, Mojica, Evelyn, and myself, we banded together and we said, okay, let's make this happen. You know, we were receiving requests from people to take diapers off of their hands, to accept cash, because they are, you know, fully understanding that we work in these spaces. We accepted and we created an operation. And I think that's what we're most well known for people who are familiar with BX Rebirth, you know, our mutual aid work. And that's shown up in the ways in which we've urged people to support us and invest in our communities, you know, by dipping into your pockets and, you know, supporting our PayPal, and we're really, really grateful for that. In 6 months, we were able to raise about $100,000 in completely crowdsourced funding. We have created a community of about 650 Bronx families. We've donated about 75,000 diapers. And yeah, I want to say a little bit about the other arms of BX Rebirth. But Evelyn, did you want to add anything?
Not this second. Oh, go ahead.
Okay. All right. So with COVID, we saw that people were in need and they needed things fast. And we formed what essentially is a rapid response. We are, you know, planning to continue to do that in 2021. However, we also formed just out of rage, you know, at seeing what was happening within the birthing space, specifically where Black and Brown folks are concerned. So, you know, one of the things that we sought to do was ensure, and continue to do, is ensure that some of our demands are met. And I'm just going to read through them really quickly. The first being, well, all of these are intended to achieve healthier outcomes for Black birthing people and their children. And so the first demand is to hold hospital administrations accountable for the ways their medical staff treat our community and families. Individual doctors are not the problem. It's difficult to track down a single person to blame, but rather an entire system of anti-Black, racist, depersonalized care. The second demand is to provide universal health care for all people in New York State, passed the New York Health Act. And, and in large part due to our connection to Katie prior to forming, and, it's that relationship having continued, that demand is still one that we want to continue creating support for and advocating for. We want to implement accountability measures for hospitals to publicly be held responsible for patient mistreatment, fully integrate midwifery care into hospital-based maternity care, grant licensure to certified professional midwives for the expansion of access to home birth for Black, Indigenous, and people of color, establish scholarship funds to support BIPOC midwives, support the establishment of midwife-led birth centers in the Bronx and throughout NYC. So, BX Rebirth, we stand in full solidarity with the Birthing Place BX. And finally, to provide full insurance coverage for all forms of midwifery care. And, Evelyn and I, we were putting our heads together and we were wondering, like, okay, so what is the ask tonight? We're usually asking for money. But tonight we are asking for, we're looking to create essentially a policy and advocacy arm. We want to build that out. We've been focusing a lot of our attention on the mutual aid work. We recently launched a doula program. We've been able to get that off the ground, but we really want to strengthen the advocacy efforts because we know that this is an operation that needs to be longstanding. And in order for that to happen, we need to continue to be active in this work. So if folks are specifically called to work with BX Rebirth in that way, please do send us an email at Bronx, the entire word spelled out, rebirth@gmail.com. Did you want to add anything, Evelyn?
No, I think that you added everything. I was just introduce myself. Hi, I'm Evelyn Alvarez, doula, badass, part of BX Rebirth, and always happy to be in community with all of you amazing people. Thank you, Katie, for including us. And yes, we are trying to we're working on getting this advocacy piece off the ground. But if y'all got coin or know somebody with it, we're also not saying no to money ever. So also please use the information that is in the chat to be able to send us some funding that will enable us to continue to do the good work that we're doing in community. And also, often people ask, like, how do people get in contact with you? Currently, we are only doing donations in the Bronx, and I think that's really important to note. But we support as doulas in all boroughs, so we should be clear about that. And so if you are in another borough and you're also doing mutual aid, then please let us know, because often we can also send people your way.
Yay, awesome, guys. Thank you so much for coming, for introducing your work, and for all of the amazing work that you've been doing. I am so excited for Bronx Rebirth to be leaning in more into the policy side and to be working with them around that. So I'm just yeah, please get in touch with them if you are interested in working on policy. If you have money, if you know people with money, give it to Bronx Rebirth, because it'd be amazing if we could pay some policy people. I think in a lot of other nonprofit spheres, a lot of a lot of housing justice groups, a lot of nonprofit groups have a policy person whose job it is to track legislation, to do teach-ins, to do updates like this. And I think something we've really been suffering from in the birth community is that very few maternal health justice related organizations have policy people. So let's get Bronx Rebirth money so that they can keep doing the amazing work they've already been doing, and also pay the people who work with them to develop policies. Yeah. And then also I'm gonna keep Save a Rose, you guys are up next. If you guys want to unmute yourself to do the presentation, and then as Save a Rose is presenting, I know folks are going to have to log off. We'll see what this was aiming to end at 8:30. We'll see when it actually ends. We get that you have to log off when you log off. So as Ava Rose is talking, I'm going to be putting in the main follow-up form for the Movement to Birth Liberation that I'm operating. And this is when, like, we keep coming back to, like, we need to have groups of people in their legislative districts who are able to reach out to their senator and get them on board with legislation. This is how we know what district you're in and how we can connect you to the other people in your district who are working on similar things, is by having you in this database. So let me throw to Save a Rose, and please, if I don't already have your information, go ahead and click through on that form and give it to us while they're talking.
There we go. Hey guys.
Hey, Bruce.
Hey everybody. It's finally good to see everyone. I've spoken to a lot of you over social media. Hey Katie, hey Nubia, hey Mila. Good to see all of you guys. So yeah, my name is Bruce McIntyre. I'm the founder of Save Rose Foundation. I started the Save Rose Foundation in behalf of my late fiance, Amber Rose Isaac, who passed away due to medical negligence on April 21st, 2020. I have been advocating every single day ever since the very next day of her passing. We have gained a lot of media attraction. We've went viral. We've touched places from, all over the States to Uganda, to Paris, to Germany. I've been on so many different docs. I've spoken to several different colleges, including Harvard and New York School of Medicine. I have spoken to almost every social media outlet or every media outlet for advocating. And I finally took a well-needed break and I got much sleep. So I'm grateful for that. I was actually supposed to have a meeting with Rivera's office today. However, they did reschedule because they do want me to speak to a specific set of people. So I've kind of more or less been gearing towards Rivera's side because it looks like they really are trying to help us and aid what we're trying to accomplish. And of course, I've been working very close with Katie in regards to bills and trying to create bills and, get legislations passed. I've been a part of the efforts towards bringing a midwifery-led birthing center to the Bronx with Birthing Place BX. Nubia has also started this Amber Rose Isaac Scholarship, Home Access to Scholarship program, which is something that Save Rose is also trying to help with because we feel that is very important. I stepped into this work to assure that this doesn't happen to other families, because what I've had to experience is just nobody should ever have to go through that. So I made it my responsibility to make sure that this doesn't continue happening. And I've been working very closely with the birthing community, very closely with different legislators, Lauren Underwood's office, different Congress members, city. I actually did a testimony as well for Rivera for the last city council meeting. So I've been advocating profusely.
Bruce, is there any, so we've been talking a lot about how we need folks to start getting in touch with their representatives now, to start building relationships with their representatives now, not because we have legislation ready to go now that we want to get passed, but so that in the future when it's ready, we have like a network of folks who are able to help get legislation passed quickly.
Mhm.
So Save a Rose, like that's one of the main reasons, Save a Rose is one of the main people who I'm working with, who I'm excited to eventually have legislation to put forward. So please, if you're looking and thinking of ways to support Save a Rose, definitely starting to develop that relationship with your own legislator, so it's not just Bruce reaching out to a bunch of people, but that it's all of us together who are reaching out to our reps. And Bruce, are there other ways right now that we can be supporting you and the Save a Rose Foundation?
So the only thing that I can think of right now, at this moment, is we're actually starting our funding project tomorrow. Tomorrow I'll finally be dropping our funding project. Was supposed to do it today, but I had a couple things that I needed to take care of first. But we are pushing that for tomorrow, so that's something that I'm very excited about. So we can get some help from, the people that are going to step up and really want to help out with the community.
That is awesome, Bruce. So keep your eye out on our social medias, and we will be sharing as soon as that GoFundMe is ready. And then please, those of you with money, donate. Those of you without money, who in your life does that you can share this with. And let's make sure that Save a Rose's fundraiser gets off to a good start. Nubia, I didn't know if you would be able to join us tonight, but I'm so glad you're here. And seeing as you are, would you mind sharing for a couple of minutes about the Earth Grounds and kind of the work you have going on?
Sure. Hi. Yeah, I wasn't sure I was gonna get on. Mondays are like my busiest day, so I literally just finished at like 8 o'clock. But so happy to see so many people's faces, and Happy New Year to everybody. Yeah, so for those who don't know me on the call, I'm based in Yonkers, New York. My nonprofit is Birth on the Earth, Inc., and was basically created out of a great need in Yonkers. We only have one hospital here that does births, high C-sections, don't do VBACs, the whole nine. So the majority of what we do is creating access to just options for where and how people give birth, and connecting them with free childbirth education workshops, connecting them with labor support. And we're expanding. We finally have a brick and mortar building, thank goodness, which is called Earth Grounds. And our opening will be this Thursday. Soft opening because of the pandemic. So we'll actually do a virtual opening over the weekend as well, where people can, ask questions and get a little walkthrough. The idea is we'll have regular community events that will always be free to the public, happening on an ongoing basis. So that's the Art of Birthing. That is the Village Baby Showers that we do. And the Village Baby Showers are basically to connect families with resources, especially now with the pandemic, where you can't always have an actual big baby shower, but sustainable items. So cloth diaper starter kit, wrap carriers, and things that people can, use multiple times. We also will eventually have Chocolate Milk Cafe out of there if we go back to in person. And Fatherhood Fridays is something that Bruce and I have been talking about, like centering spaces for new fathers and single fathers, and just, anybody who wants information about fatherhood as well, whether they're a father to be or will be years down the line. We also train birth workers as well, specifically in traditional care. So that will be something that will be happening. We'll have ongoing programming for birth workers. The biggest thing that we've done in 2020 was the Access to Home Birth Scholarship Fund, which basically was something that we created in March, but we renamed for Amber Rose Isaac in April. And our goal was to help one family per month from March to the end of the year. We've now helped 22 families, which, it's just the need keeps coming in. the donations keep coming in, so we're able to keep helping families as they need that. And so far, all of the families have had beautiful, amazing home births. So I'm really, really happy about that. And that's something we want to keep going. If anybody's interested in doing the virtual open house, we'll talk a little bit more about the programming. But for January, one of the things we'll be doing is a toiletry giveaway and clothing giveaway for any displaced expectant mothers or soon-to-be mothers. Yonkers, where we're located, has a very big homeless community that was displaced. They closed down one of the only homeless shelters in Yonkers. So there are a lot of young women just roaming the area. So we want to make sure that they have the necessities in a place that they can come to get those things. So yeah, I think that's it in a nutshell. And thank you. Good to see everybody's faces.
Yeah. Thank you so much for joining us, Nubia. I'm so excited to, I'll be RSVPing soon to the virtual open house, and I'll be excited to join that with you this weekend. And the other exciting thing about Nubia's venture is that it takes place in Yonkers, which is the district of the Speaker of the State Senate right now, who is not yet in support of the New York Health Act. So she is doubly important, because if she decides to support the New York Health Act, we could pass it immediately. And if other people decide to support the New York Health Act and we have the votes we need, the speaker could choose to foil all of that activism work by just choosing to not call it for a vote. I'm super excited about all of the work Nubia is doing, and in part because it gives us a hub to have political pressure on one of the most influential people in New York. So hopefully if Senator Stewart's Cousins isn't already enthusiastic about the New York Health Act, we'll help her become enthusiastic about the New York Health Act.
Yeah, and she's invited Thursday night, so we'll see if she shows up. A lot of other legislators responded, but I haven't got her RSVP yet, so I'll send her another gentle reminder that she needs to be there. Yeah.
That's great. And something we'll do in the future as a movement is using social media. So when Nubia invites Andrea Stewart Cousins, how we can all elevate that on Twitter and other forms of social media to put pressure on electeds to keep tabs with us. So It is 8:33, which is already 3 minutes after when I thought this would end, and I still have 10 to 15 minutes of things that I would love to tell you guys about. So if you have the time and you are able, please hang out with me. If you are not, thank you so much for joining us. Please help us spread the word about everything that's going on tonight. Not everyone's going to tune in to a 2-hour YouTube video that's just talking heads of Zoom. So the more folks we have by word of mouth communicating the bullet points, the most important parts, the better it will be. So I'm just going to go back to this screen share and talk a little bit. Essentially, we talked a bunch about how the Birthing Place, Earthground, Save a Rose, all of them are somewhere in process of writing legislation. But what is the legislation that currently exists that we can be pushing for that will benefit all of us and help us, help move us in a direction for reproductive justice and in a direction where we're more able to get the laws that we want to write passed once they're written. So the first is the Momnibus, and Lisa is an organizer who's been working with me and has read all 200 pages of the Momnibus. So I wanted to throw to her for a couple of minutes for just kind of the bullet points of what the Momnibus does and doesn't do, and who from New York is currently supporting it where we need support.
Yeah, hi everyone. I'll be really fast, I promise. So the Black Maternal Health Momnibus Act of 2020, that's what it's called, was introduced in the House in March of last year, but hasn't gone anywhere. I it's a pretty straightforward, pretty basic sort of collection of lots of small bills that are basically just trying to address maternal health disparities specifically for Black and Indigenous people, but they also have specific actions or like they want to address like incarcerated birthing people and improving like removing their shackles, making that like federal legislation for birth, and also doing little things like even increasing the postpartum period instead of it being the 6 weeks it is now up to a year. So that could increase the time that birthing people can get benefits from public, services. So anyway, just little things like that. It's basically just a very vague, very broad sort of thing to create a task force across a bunch of different committees that would all look at how they can contribute to improving maternal health in the country. And that's pretty much it. It just provides like grants and commissioned studies. And then the idea is after 2 years after it's passed, they're supposed to present some sort of, report about the different things that they could do to implement, like that they should be implementing and whatever. I say that the biggest thing, the most important thing that would come out of this is probably all of the grant money that local organizations like here in New York could apply for in order to use it for their local community services. I do want to just write in the chat, hopefully this works, but this should show you all of the co-sponsors from New York. And there's, there's a few from District 7, 25, 10, 16, 12, 3, and 9. Yeah, they're right there. So you can see if your House representative has co-signed on it. And if not, then I guess the idea that we're going to have is basically create just like a working group. We'd probably only meet like once a month, and it would only be to say like, hey, how's everything going? Have you contacted your reps? Do you know anybody who can help? Just reaching out to ask people to co-sign. And then eventually when it moves to the Senate, we do the same thing. And then the nice thing about it being federal legislation too is if you know people in other states, then you can also get them involved. It's really not hard. And also it is pretty, like it shouldn't be a partisan issue. I don't foresee like Republicans being like, no, I don't want to help mothers. So I think that it should be pretty straightforward. It's just that like Congress isn't paying much attention to it right now. So if you would like to get involved, I guess just let Katie know and she'll let me know. And then I will try to organize something this month to just get everybody together to just explain it a little more.
Awesome. Thank you so much, Lisa. Yeah, as Lisa said, probably the biggest amazing cool thing that the Momnibus does is set aside a lot of grant money specifically for organizations that are led by Black and brown people in districts that have disproportionately high rates of poor infant maternal health outcomes. And I literally just described Central Brooklyn and the Bronx. So everyone who's talked so far today, Save a Rose, Bronx Rebirth, The Birthing Place, Earth Grounds, all would qualify to get grant money to do the amazing work that they are already doing better and more equitably financed and at hopefully at a larger scale. So it won't fix maternal health issues. It's not a panacea of like all things that are plaguing maternal health in America. But again, if we can organize ourselves and have pods of people that know that can work together to get their congressperson on one piece of legislation, then that same group of people will be able to use those skills and use those relationships to get them on other things going forward. So the Momnibus is the one piece of federal legislation that I've been really paying attention to at the state level. the number one priority for me, for almost all health justice, housing justice, economic justice, educational justice, pretty much all the activism justice groups in New York, their number one priority for the 2021 legislation session is make billionaires pay. I think 100 people have made $600 billion since the pandemic started in New York, which is like 4 times the amount of our whole state's budget on a yearly basis. So Cuomo is putting us into austerity measures and has threatened cuts across the board from education, from hospitals, from health services. Ostensibly because we don't have the money, and well, like, what are we gonna do? How can we pay for it if we just don't have the money? And it's like, hey dude, we do have the money in this state. You just have to do this crazy thing called taxing, which is like literally one of your only jobs as the government. And then we would have that money to fund all of these other services that we need. So even in the campaign for New York Health, the New York Health Act activism crowd, New York Health Act is even kind of second priority, like we definitely want it done this legislative season, but essentially like we want week 1 to pass all of the bills that we have ready that would tax the rich, so that week 2 we can pass the New York Health Act. And the Democratic legislators who are not yet in support of the New York Health Act, a lot of them say like, oh, well, how are we going to pay for it? What if it ends up costing more than we think it will? Well, hey, last week we passed 14 different bills that tax the rich in various ways. So if the New York Health Act ends up costing a little bit more than we thought it would, that's how we'll pay for it. We'll do what we just did, tax the rich. So this is like, there are right now 14 different bills that I know of that all tax the rich in various ways. If you go, I'm going to put into the chat our Tax the Rich tracker. And if you, which is something that some volunteers made over the summer, and it has all of the senators, all of the different bills, and whether or not they are co-sponsor of it. So we do need to update this because there's been some movements after the election, like some of these senators aren't senators anymore. We need to update it with the newbies. But definitely check this, see how many bills your senator is a co-sponsor of, and then particularly if they are not co-sponsor of more than 1 or 2, this is the issue that this week you want to start calling about and saying, hey, I'm a constituent of yours, tax the rich. I'm not going to be okay with you voting at the peak of the pandemic in 2020. Governor Cuomo pushed through a budget with $2.4 billion to Medicaid, and so the maternal deaths that we heard of in April and in July, those happened at hospitals that had just had their budgets cut in the middle of a pandemic. So it's really important we keep clear there is interpersonal racism happening that we need to address, but it's also really important that we keep clear the structural racism that allows all of that interpersonal racism to occur. A lot of that is happening with these types of budget cuts that are happening because of austerity measures that won't need to occur if we just tax the rich in New York. Now, I didn't chat with you before, but Natalie, wave hi. Natalie's been working with me on this issue for a while. If you go to our Tax the Rich tracker, you will see a sample script. That is something that Natalie put together. You can use this as a basis for your other script. I've been asking lots of people to put more scripts in here. Natalie's the only one who's done it so far. So please join Natalie in adding more sample scripts to this database. And hopefully we can be a powerful part of the coalition that makes billionaires pay and prevents us from going into like meltdown mode as a state through austerity measures. Then once we are taxing the rich, we want to pass the New York Health Act. Is Hannah still here? Or did I out? I outlasted her. Hannah is a lot of, if you remember from our slides up here, the vast majority of the work that we need to support the New York Health Act is in Long Island and upstate New York. Hannah Diamond is a doula that's been doing some great organizing work out here in Long Island to put pressure on her reps. So if you live in Long Island, if you have friends in Long Island, that is who I'm going to be connecting you with. And then I just want, like, just think, like, who do I know in upstate New York and Long Island? Who did I go to doula training with that lives in one of these cities in upstate that I can call and say, hey, did you know we're close to passing the New York Health Act? It's probably unlikely for us to get many Republicans to sign on, but we went from having 9 Democrats whose minds we could convince or minds we needed to change to having 14 Democrats whose minds we can change to try and get the last support that we need to pass the New York Health Act. So who are the birthing people, the birth workers that we know in these areas, and let's start working together to get that passed and make billionaires pay. Also, if you are in New York City and your legislator is already a firm supporter of the New York Health Act, no need, like, if your senator is Senator Rivera, Senator Salazar, Senator Brizport, these are people who put a lot of time and energy into trying to get the New York Health Act passed. So no need to call them and ask them to pass the New York Health Act. If you live in one of those districts, though, I would really recommend looking up the New York City Democratic Socialists of America Healthcare Working Group, because they have a lot more energy than I do to put events together in this city to raise attention and support for the New York Health Act. And then last, but certainly not least, the piece of legislation that currently pending that we want to work on is on the state level is A3808A. On the federal level is HR 40. And those are bills that would initiate the process for to pay reparations for slavery and state-sanctioned segregation. And the reason why we want to work on this is twofold. The first is I first learned about racial health disparities as a nurse in 2017, but that is not when racial health disparities started. We have had racial health disparities in the United States of America since race was created as a tool of socioeconomic oppression during chattel slavery. And so since we first started recording infant maternal health outcomes from 1850 until now, overall mortality rates are going down, but the disparities between Black and white people are getting worse. So if we want to if we really want to end racial health disparities, that means we have to address where they started, and I think one of the ways to do that is by engaging in a thorough and thoughtful process of truth, reconciliation, and reparations. And there are already there are bills at the state and federal level that would initiate those processes. And the second reason why is because something that Sava Rose and I are in the early talks for, but a bill that we would potentially like to write is a bill that would provide reparations to the families who have survived a pregnancy-related death. We know that nationwide, over 60% of pregnancy-related deaths are preventable, and New York has the most dangerous hospitals of any state in the nation. So it stands to reason that more than 60% of the deaths in New York are preventable. So if the majority of deaths are preventable, why are we putting the burden of responsibility to pursue justice on the family that has already experienced this horrible loss? So an idea that we are working with and that we are talking about with legislators is, can we write legislation that says every family that experiences a pregnancy-related death will receive these payments from the state until that child is 22 years old, and then receives some kind of trust fund to make up for the fact, to make up for the lack of support as they're an adult and lack of an inheritance because of the preventable pregnancy-related death. And so I think this is a good idea, and I think it could really help a lot of, really be a tangible help to a lot of people who are really suffering in the wakes of preventable maternal deaths. And when I first brought this up with Senator Rivera, he said, yes, that does sound like a good idea, but do you know there already is a bill for reparations and that's not going anywhere? So are we going to get a bill passed to pay reparations to to the families of people who have died of preventable causes if we can't even pay or start the process of paying reparations for slavery? And I thought, good point. Let me learn more about this bill and see if we can and make this a part of our legislative agenda. So that is, guys, thank you all for sticking with us. That was a long Movement Monday. We will be workshopping and brainstorming how to best use this time to keep it informative and energetic, and a place where, folks have a place to come and learn and share, and that hopefully won't be 2 hours. So please keep the first Monday of the month in February free. Generally, keep your eyes out for some teach-ins we'll be putting together throughout the month. I think I'm generally going to be keeping Movement Monday free because of the alliteration, because I like Movement Monday. So it sounds like I'll just make my things on Monday. But if that day is horrible for most people, please let me know and we'll keep working things out. It was so great having you all here. Thank you all so much. I hope you have a great night. And I look forward to working with you guys soon and becoming a movement that births liberation.
Thank you. Good night, everybody.
Good night, everybody.
And then if folks who are involved in planning want to stay on for just a minute, if you have the energy. Hi, guys.
Hey, congrats on your first Movement Monday.
Thanks. How are you guys feeling? How do you think that went?
Yay! Go, Katie. Can we stop the screen share?
Oh, yeah. Let me stop it, and I'll stop the recording.